All right, good afternoon, everybody. My name is Elias George, Deputy City Attorney for the City of Las Vegas. I'd like to call this Community Development Recommending Board to order, please. Today's date is February 3rd, 2020. The time is 1:30 p.m. Madam Clerk, are we in compliance with the open meeting law?
Yes, we are, and the correct time is 1:39. I'm sorry.
Oh, I'm sorry. Could you please take roll?
Yes. Member Janison?
Here.
Member McKnight? Member Moreland?
Present.
Member Miller?
Present.
Member Jimenez? Member Washington?
Present.
Erica Washington?
Present.
Oh, thank you. Member DeSalvio? Member Sales?
Present.
Member Summers Armstrong? Member Bruno Walsh?
Present.
Member Haddad?
Present.
Member O'Rourke?
Present.
Member Harper?
Here.
Thank you.
Do we have a quorum?
Yes, we do.
Okay, moving on to item number 3 of the agenda, public comment portion. Comment during this portion of the agenda must be limited to matters on the agenda for action. If you wish to be heard, come forward and give your name for the record. The amount of discussion as well as the amount of time any single speaker is allowed may be limited. Seeing none, we can move on to item number 4 of the agenda for possible action to approve the final minutes by reference of the regular meeting of March 26, 2019. Is there a motion for approval on the minutes?
Member Janison, motion to approve.
Okay.
Member Miller, second.
All those in favor of the motion, please cast your votes.
Aye.
Aye.
Any of those opposed? Seeing none, Madam Clerk, the motion passes.
Thank you.
Agenda item number 5, Angela Washington for the record. Agenda item number 5, discussion for possible action regarding the election of chair, co-chair, and alternate chair. I would like to take nominations at this time for the office of chairperson of the Community Development Recommending Board. Are there any nominations?
This is Member Janison. I'll nominate Member Deshawn Miller.
For which position? This is
for all of those? For all of them? No, that was a question. Yeah, she gets them all. I'm sorry, was it for all of the positions?
for
or just
the
one?
office, Angela Washington for the record, for the office of chairperson.
Yes, Office of Chairperson, I recommend, I nominate Member Deshawn Miller, please.
Member Miller, you've been nominated for the position of chairperson. Do you accept the nomination?
Member Miller, I accept the nomination.
Thank you. Are there any other nominations for the office of chair? Seeing no other nominations, I hereby close nominations for the office of chair. All those in favor of Member Carmen LaShawn Miller serving as chairperson of the Community Development Recommending Board, please signify by saying aye.
Aye.
All those opposed? Thank you very much. For the office of co-chair, are there any nominations for the office of co-chair of the Community Development Recommending Board?
Member Carmen LaShawn Miller, I nominate Terry Janison. Member Terry Janison, please.
Thank you. Member Janison, you have been nominated for the office of co-chair of the Community Development Recommending Board. Do you accept the nomination?
Yes, I do.
Thank you. Are there any other nominations for the office of co-chair of the Community Development Recommending Board? Seeing no other nominations, I hereby close nominations. All those in favor of Member Terry Janison serving as co-chair of the Community Development Recommending Board, would you please signify by saying aye?
Aye.
Aye. Aye.
All those opposed? Thank you. For the office of alternate co-chair of the Community Development Recommending Board, are there any nominations for such office?
I nominate Dave Merlin.
Mr. Marlin, you've been nominated for the office of alternate co-chair of the Community Development Recommending Board. Do you accept the nomination?
Would be an honor.
Thank you
Yes.
thank you very much. Are there any
Excuse
other
me.
nominations?
Excuse me, I'm sorry, this is Gabby, the clerk. Who made the nomination, please? Thank you.
Thank you. Are there any other nominations for the office of alternate co-chair? All those in favor of Member David Marlin serving as alternate co-chair of the Community Development Recommending Board, please signify by saying aye.
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 Thank you. All those opposed? Thank you very much. Mhm. Yeah, you can call it.
Okay, moving on to item number 6, report by Angela Washington, Grant Program Coordinator regarding Housing and Urban Development HUD federal grants and scoring of federal funds.
Thank you. Angela Washington, Office of Community Services, for the record. The City of Las Vegas's grant application process began on Monday, October 14, 2019, with the posting of a request for proposal, RFP, for agencies seeking program funding from the city's allocation of community development block grant dollars and from its allocation of housing opportunities for persons with AIDS, HOPWA grant dollars. Interested agencies were asked to attend one of 3 available technical workshops held on October 29th and October 30th, 2019. The approximate amount of funding for CDBG programming is $740,000, and the approximate amount of HOPWA funding is $1.2 million. The RFP closed on November 21st, 2019, and the Community Development Recommending Board received eligible applications for review on December 9th, 2019. The Community Development Recommending Board, CDRB, over 2 meeting days, will hear from applicants who met eligibility. The applicants' appearances before the board are divided into 2 categories: returning programs and new programs. Returning programs were not asked to offer a full presentation to the board, but instead were asked to be available for questions that the board may have regarding their applications or programs. Applicants with returning programs have been allocated 5 minutes each for questions the board may have of them. New programs have been asked to make a presentation to the board. 10 minutes have been allocated for each new program, which is broken down into 5 minutes for the actual presentation and 5 minutes to answer questions from the board. Today's meeting is being held in the Las Vegas City Council chamber. However, all subsequent meetings will be held as advertised. At this time, I would like to take a moment to ask all board members who have any potential conflicts of interest associated with any of the agencies that will appear before the board today to disclose those conflicts at this time.
This is Member Janison. I work for the Grant to Gift Autism Foundation.
Thank you. Are there any other potential conflicts?
Member Miller, presentation, I believe, from the Clark County Public Education Foundation. I'm participating in one of their programs.
Thank you.
Dave Marlin. I've been a board member of Help of Southern Nevada for 12 years.
Thank you very much. Are there any other potential conflicts? Thank you. Madam Clerk, we have one adjustment to today's agenda, please. Help of Southern Nevada has withdrawn its HOPWA application for its program No Place Like Home and will not come before the board today on that program. Help of Southern Nevada, however, will appear before the board for CDBG applications, but will not come before the board for the posted HOPWA application. Thank you. It goes to the chair now.
Member Miller, Ms. Washington, is there a particular script you still want us to follow in terms of introducing and reviewing, or should we just go ahead and begin the schedule?
What you will do, thank you, Angela Washington, for the record. Chair Miller, what you will do is you will call for the question and answer portion. You will call for questions of the board for each program listed. If there are no questions, you will move forward to the next program listed. If there are questions, you will ask that agency to come before the board to answer questions of the board. Does that make sense?
Thank you very much. And I'll ask for our board members, welcome aboard our new board members. So if I look at you, it's because I don't recognize your last name, so please don't think I'm being disrespectful. If you have a question, I want to make sure that I learn everyone's name. I appreciate your patience. So with that, we can go ahead and call the first group in front of the board. And I believe, if I'm on correct or not, AFIT, right?
Angela Washington for the record. Yes, ma'am, you'll take them one at a time.
Okay.
Thank you.
All righty, and we will stay on schedule. At this time, I'd like to call in front of the Community Development Recommending Board, AIDS for AIDS Nevada, AFAN, for their AFAN housing project. If you'd come forward, please. Only if you have questions. Board members, do you have any questions? And I believe we do, so come on down. Welcome. And I believe the chair will recognize Member Janison.
Thank you, Madam Chair, and welcome. Thank you for being here today. As I'm looking at your application, if you could address question number 31 in regards to your audit. It says, year-end 2017 finding audit was not submitted to the Federal Clearinghouse within 9 months after the fiscal year end. And that's all I'm seeing. What does that mean, and was there not an audit?
Yes, you want to speak?
Yeah.
Your name?
This is Lindsay. I'm the finance manager.
And I apologize, could you give your full name for the record, please?
I'm sorry, Lindsay Atkins. We did submit year-end 2017. I believe it's 2018 that we're late with.
I guess I'll ask my other committee members, am I just reading this wrong? It looks like it's not a full sentence. So where it says audit was not submitted to the Federal Clearinghouse within 9 months after the fiscal year end, that's referring to 2018. So your current audit that is attached is your 2017?
Yes.
And that's,
Yes.
okay. All right, thank you.
And the chair recognizes Member Member Harper. Thank you.
Thank you, Madam Chair. Member Harper, I have a question about the, thank you for being here. I have a question about your spend. Our notes say that you were looking to commit to spending the funds that were allocated by December of 2019. I wondered where you were in being able to provide the benefits to the intended recipients.
We had an extension. We did not have an opportunity to do that. We are waiting for, my name is Antioco Carrillo, by the way. I'm the director of APAN. And we are waiting for $50,000 from one of our sponsors to spend the money, and they were supposed to give it to us in November, and that was what we were going to spend. So we're still pending that reimbursement from that sponsor. It's from Walgreens. So we have not been able to do that. We were given another opportunity to spend them by June of this year.
Right, so it says that, Member Harper, it says that you were given the extension, so I guess we should understand that you didn't have the funds available to you to make the spend.
Right, we had to have the funds available before we spend them so we can submit for reimbursement.
Okay.
And it was during the later part of the year that we were hoping to get the $50,000. Now, we are on target to spend it by the allocated extension because we have our AIDS Walk, which is our major fundraising event that is coming up in March. So we should be able to spend the entire amount.
Okay, thank you. Madam Chair, may I ask a follow-up?
You can continue. Go ahead, Member Harper.
Okay, Member Harper again. So in the notes, they indicated that you had 245 households that you intended to provide benefits to, and that 106 have actually received those. Can you help help us understand why the others have not been.
Part of the reason was internal structure that we had. We had to move locations, and in the move, we lost some of the people that were were getting services. We moved from our previous address to the current one. And the other part is that we had a few months trying to get a couple of staff members that, they resign or they move on to another career, and we had challenges filling out the positions.
Thank you very much.
Chair recognizes Member Janison.
Thank you, Member Janison. I'm going to go back to the audit. I just pulled it up. Am I just missing, were there any findings? Did you have a clean audit in 2017?
Lindsay Atkins, yes, we did.
Okay, thank you.
Do any of the members, this is Chair Miller, I believe we're at 5 minutes, and so we want to thank you for coming in front of us and answering our questions. Thank you very much.
Thank you.
And also, to step back a little bit, I want to make sure that I read into the record that we are on agenda item number 7, discussion regarding allocation of funding for fiscal year 2020-2021 and 2021-2022, housing opportunities for persons with AIDS, HOPWA funding for, we just heard for AIDS Nevada, AFAN. Next, these are the following organizations that are coming before us: Golden Rainbow, Women's Development Center, the Gay and Lesbian Center of Southern Nevada, and we were also made aware that Help Us Southern Nevada will not be presenting in HOPWA, but be presenting later on to speak. With that entered in the record, I'd like to now move on to the agenda to see if any of board members have any questions as I call forward Golden Rainbow HIV Housing and Support Program. Are there any questions? Okay, Golden Rainbow, if you'd come on down. We believe you have a question from Member Harper. Thank you very much. Member Harper, whenever you're ready, sir.
Hi, Member Harper. Thank you very much for coming. Just a couple of notes about the performance from the last funding, showing that there was unspent funds for fiscal year 2018-2019. Do you mind sharing with us why that may have been the case?
The funds that were unspent during that particular...
I'm sorry, make sure.
My name is Gary Costa. I'm the Executive Director of Golden Rainbow. The unspent funds that were not spent were from our housing program, and right now, because of the housing rental rates, we weren't seeing as many clients moving into new places. The funding that we receive is not for rental assistance, but for move-in expenses, and because, like I said, because of the housing situation, we did not have a whole lot of new move-ins during that particular fiscal year, but we have since spent the funds, and we are now on track this year to spending our allocated amounts.
All right. Thank you very much.
Sure.
Thank you, Chair. Thank you, Madam Chair.
Member O'Rourke?
Hi there, Member O'Rourke. I had a question about the assistance checks. Are they actual checks, or are they vouchers written to a specific place, or does the person get a check?
We actually issue checks, but the checks are not made out to the client. They are made out to the actual landlord, the service provider, or the utility provider. And they have strict controls with our bank that do not allow any check to be cashed at like a check cashing place or anything like that there. They're all really strictly controlled.
Members of the board, do you have any further questions? If not, I'll allow Golden Rainbow to step back. And seeing none, thank you very much for
Thank you,
coming
Madam
and
Chair.
spending time with us. Thank you very much. Okay, moving forward, the next group, if the board has so inclined, this is Chair Miller for Q&A, Women's Development Board, their HOPWA program. Do any members have any questions?
Can you give me just a second to pull this up?
Okay, I will give you a second. Seeing none, we'll move on to the next Q&A presentation. The next group, and I believe I'm ahead of schedule, yes. The Gay and Lesbian Center of Southern Nevada, their HOPWA Support Services. Do any members have any questions? So if I need to call them forward for you. The chair recognizes Member Janison, so hold on, let me call him down. I'd like to call the Gay and Lesbian Center of Southern Nevada, HOPWA Support Services. If you could step forward to the microphone. Please remember to state your name for the record. Thank you so much for coming. Member Janison, when you're ready.
Thank you very much, Member Janison. Good afternoon, thank you for being here. I'm looking at your application, and on question 25 regarding the data for the past 3 years, for 16, 17, and 18, it's exactly the same number. So can you just talk a little bit about how you're collecting data, and why is it that it's 56 people that you've helped every year for the past 3 years?
I'm sorry, can you repeat the question?
Yes, sir. Question 25 on your application.
Yes.
It says data for the past 3 years. So for each year, it's been the exact same number as 56, unduplicated. And I'm just curious as to how you're collecting the data, and why is it, I mean, it's just unusual for me to have the exact number of people that you're helping for that many years in a row.
Right. I believe this was a mistake because it was
Please make sure you identify yourself, sir.
My name is Vince Collins.
you.
I'm the Director of Operations. So our accountant drew from an impact statement and did not gather all the information to answer this question correctly.
So, Member Janison, follow up if I may. So then can you tell us, how do you collect your data to show that you are having the impact that you say that you do with the funds being used, please?
So this is our first year using monies for HOPWA. So we're in the middle of our first year. So currently we're using a database that's sort of in line with another program that we have, our Ryan White program, Careware. So we gather data from different sources, as well as internal and from the county.
So, Member Janison, follow up. And I'm just going to push a little, because data is really big for
Sure.
this board, and the importance of using the dollars properly in the right way, and the reporting back to the federal government as well. So I guess 2 pieces of clarification. So then the answer that was incorrect on here is that you didn't provide services in 16 and 17, so that would have been 0. So you didn't have 3 years of data.
Right.
And then secondarily, I guess I'm still trying to understand, so this year, someone comes in, you're collecting it through, is it a Careware, is that?
Right. Go ahead and answer.
So if you could go into a little bit more detail on that, I'd
Yeah,
appreciate it.
Is that okay? My name is Todd Dickey. I'm the HIV Services Manager at the center. So we do collect data through Careware, and then through our testing clinic as well. Then we compile that into an annual impact statement. Unfortunately, this was replicated. The numbers are not the same every year. So this was just, it was entered incorrectly.
All
The
right.
number is different every year.
All right, gentlemen, thank you very much. I appreciate your time.
Madam Chair.
Go ahead, Member Harper.
Member Harper, for the record, we're showing that in fiscal year 2019 and 2020, that 0 of the households received benefits. 60 were projected. There are 2,700. 60 were projected, yet we're showing that 0 of those households received benefits. Can you speak to that, please?
Right. Currently, we're sort of reorganizing this grant. So when we initially had gotten this grant, we weren't aware that we were actually getting HOPWA, so, and we were in transition with our Director of Operations. So it stalled the whole rolling out process of actually implementing services. And then how we report the data is us getting up to speed, working with the city, in trying to be compliant with reporting information. And what we found is we've made mistakes in doing that, and now we're correcting that. We've just asked that data be re-released to us so that we can reevaluate it and sort of determine all the tasks that we're doing so that we get credit for the tasks that we're doing and the amount of people that we're actually referring. So hopefully, at the end of that process, we'll be able to provide more individuals who we've actually referred to service.
Can I quickly add to that, please? Again, Todd Dickey.
Please make sure you identify yourself for the record.
That was Vince Collins. Sorry.
Okay, again, Todd Dickey. So we have requested the state make changes to our CareWare system, whereas before we've only been using this for HIV-positive clients and clients that have gone through our clinic. So we've reached out to them and asked them to make changes so we can better track our HOPWA clients and then provide more accurate reporting.
Thank you for your response. We've run out of time, but thank you very much for coming forward and addressing members' questions. Very
Thank you.
appreciate it. Okay, Chair Miller, just moving forward to our next presentation, as we stated, the withdrawal of HOPWA for Help with Southern Nevada. Moving on to our presentation, we're a little bit early, which would be agenda item number 8, which is a presentation regarding application for housing opportunities for persons with AIDS, HOPWA funds for fiscal year 2020-2021 and 2021-22, submitted by Access to Healthcare Network Incorporated and Horizon Ridge Wellness Clinic Incorporated. At this time, I'd like to call in front of the board the Access to Healthcare Network Incorporated, Ryan White, for their presentation. Please know that you have 5 minutes for presentation and then 5 minutes for question and answer from members of the board. Please make sure you identify yourself as you're speaking. Welcome, and thank you.
Thank you. Good afternoon, board members. My name is Trevor Rice. I'm the Chief Operating Officer for Access to Healthcare Network.
Hi, I'm Jennifer Vasquez, Statewide Director for Access to Healthcare Network.
Dan Davis, Chief Financial Officer for Access to Healthcare Network.
It's a pleasure to be here today to present to you our proposal to expand access to evidence-based socioeconomic clinical care coordination, socioeconomic case management, and evidence-based health education services for individuals living with HIV here in the Las Vegas area. So Access to Healthcare Network, we are a statewide nonprofit with offices here in Las Vegas, Reno, and Elko, whose mission is to provide access to health care and health-related resources to low-income, uninsured, and otherwise vulnerable populations throughout Nevada. Since 2006, we have provided services to over 200,000 Nevadans. An example of programs such as our First in the Nation nonprofit medical discount program, the statewide administration of the Ryan White program, statewide administration of the Women's Health Connection program, our non-emergent medical transportation program, our evidence-based health education services, and a myriad of other services, again, that are designed to address the social determinants of health, improve health outcomes of individuals we serve, and reduce the overall cost of care for our communities. And Jennifer is going to give you a brief overview of what we do for Ryan White.
Hi, good afternoon, Jennifer Vasquez. We have administered Ryan White grants Part B since 2007. We have also administered grants Ryan White Part A since 2017. We have taken over the eligibility component, which is now rolled into the case management component on both Part A and B statewide for all of our services. We have also run the program of ADAP, which is the AIDS Drug Assistance Program statewide, for as long as 2008, I believe. So our ADAP program identifies clients that need help with premium assistance, copay assistance, and medication assistance. Sorry. So with the ADAP program, we identify clients that may or may not be uninsured or underinsured. At that time, we would help them obtain health insurance either via Medicaid, Medicare, ACA, or private insurance, depending on their employer. We have also helped with transportation in Northern Nevada, food bank home delivered meals in Northern Nevada, and medical nutrition therapy in Northern Nevada. We assist with transportation in Northern Nevada. With transportation, our goal is to get people to and from their medical services and or pharmacies.
So with regards to health education, we have been providing, again, evidence-based health education services in the form of chronic disease self-management, diabetes self-management education, diabetes prevention, medical nutritional therapy, and programs designed to address food insecurity for the past 7 years. We are one of only 3 organizations in the state who are licensed to provide chronic disease self-management education. We are one of a handful of organizations that are accredited to provide diabetes self-management education that is reimbursable by Medicare, and we are currently certified to teach the National Diabetes Prevention Program and are going through the recognition process with the CDC and CMS to be able to obtain reimbursement, again, for Medicare for those services. In addition, we've been providing medical nutritional therapy to underserved populations culturally appropriately in patient-centered fashion, including providing that to Ryan White HIV/AIDS patients for the past 2 years very successfully up in Northern Nevada. So what we're looking to accomplish with this proposal is to take the health education services that we've been doing for the past 7 years and for the past 2 years with Ryan White clients and expand it here into Las Vegas and then integrate that into non-medical case management to provide a comprehensive set of services that can address the social determinants of health, improve the overall health outcomes of the individuals we're going to serve, and again, reduce the overall cost of care for our communities. And we believe that health education services like this are the wave of the future. They're the thing that's going to improve overall health of our nation, of our communities, and the individuals that we're going to serve. And then lastly, the need, why, is right now 6 in 10 Americans have a chronic disease. With most of those, a lot of those being people with cardiovascular disease and diabetes. 1 out of 3 Medicare dollars, healthcare dollars, is spent right now on treating chronic diseases as opposed to putting services together that can prevent them or to better manage them to reduce those costs. And the cost of diabetes itself is expected to increase by up to 54% by the year 2030. So the need is extremely great, both at a national level and also here level in Las Vegas. Thank you very much, and questions?
Thank you. At this time, I'll open the floor for members that have questions. Member Walsh is recognized.
Okay. Hello, I'm Member Walsh. You're requesting about $577,000, and that's the program budget. Are there any other sources of funding that you're looking for?
Yes, there will be internal sources of funding that we already have in place to be able to support this program, such as transportation services that we're not asking through this grant. In addition, is for sustainability purposes, we also will be looking to obtain reimbursement for some of these services when appropriate, when provided, and be able to put that back into the program itself, again, for sustainability.
Chair recognizes Member Marlin.
Good morning and or good afternoon, and thank you for helping this vulnerable population. You mentioned you've helped 200,000 Nevadans. Could you tell us how you track that?
So we track it in a myriad of ways. Primarily is through our database system, which interestingly enough is actually Salesforce. So we've taken Salesforce and turned it into an EHR and a system, a care coordination case management system to track all of our care coordination activities, health education activities, transportation activities, so on and so forth. So everything is tracked locally in one database system. In regards to Ryan White, we do use the CareWare program, but we then put information to both systems to track it concurrently, if that answers your question.
Thank you.
Yep.
Chair recognizes Member Janison.
Thank you, Member Janison. So I've got a couple of questions in regards to the fact that you are statewide. You addressed a little bit about the fact that you're trying to bring that down here to Las Vegas, but you referenced a whole lot about Northern Nevada, and you're asking for a whole lot of money. And most of the money is coming for salaries. You're looking for, I think it was like $300,000 in salaries. So a couple questions. Number one, how many of your board members are from the South? Number two, how many employees are from the South? And is the money that you're asking for salaries for the people that are living here? Let me ask, go ahead and answer those first, and then I've got a couple of follow-ups, if I may, Madam Chair.
Go ahead.
Sure, no problem. So currently, there are no board members who actually live in the South, in Las Vegas area. In terms of the staffing that we currently have in Las Vegas, Jennifer can answer that question.
Yeah, we currently have 28 staff members in Las Vegas.
Are they all being, Member Janison, are they all being paid, is the money that you're asking for salaries out of this grant, are they covering the 20 employees down here?
No.
So you're asking for money to cover statewide salaries?
No. We're asking for money to cover the dietitians, which are not currently employed. We would be seeking dietitians down here. And we're asking to cover a portion of some of the case managers that are currently in place being funded through Part B grant money.
And all living in Southern Nevada?
Yes.
Thank you. Madam Chair, follow up, please.
Go ahead, Member Janison.
So Member Janison, then if you could look at your application on numbers 20 and 21 in regards to the number of proposed people that you're serving. So first of all, what is PLWHA?
People living with HIV.
Thank you. And so I see that broken down, but in number 21, it asks about how many are eligible for living in Las Vegas where the money has to be spent, and there's no number. It just says all of them that qualify. So how many people are you going to be helping in Las Vegas?
So because this is a new program that we want to bring down here, we do have data that shows how many people currently live in the city limits. However, we would need to look at eligibility determination with their income to see if they would qualify for those services. So at this time, I don't have an exact number, but it would be us pulling our data to reach out to those clients that would qualify with your income levels.
So Member Janice, and follow-up, I guess maybe it's a question for staff, but I mean, how do you track? If they've not given us any numbers about how many people they think they're going to serve with this, how do we say that we can even fund them?
And sorry, forgive me if I can interject. My apologies. I thought on question 20, if you're asking how many people we will serve, is we do list out by service type, whether it's case management, medical nutritional therapy, diabetes self-management medication, cooking classes, and food boxes, the number of consumers that we would serve in each category.
For all those numbers are for Las Vegas?
Those would be people that we believe, based upon the numbers we can pull from current Ryan White Part B clients and the population of Las Vegas, the folks that we can serve with those services. Yes, those will all be here in Las Vegas, correct.
All right, so I guess, Member Janice, I guess my confusion comes to where the question is how many total clients, all jurisdictions combined. So your numbers up there are all jurisdictions combined is how I read it. And then 21 says, well, how many for Las Vegas? So you're saying that number 20 are the actual numbers that you're estimating to do just in Las Vegas?
Yes, correct.
Yes. Okay, thank you.
Chair recognizes Member Harper.
Thank you, Madam Chair. So, thank you for being here. Thank you for your presentation. If you were funded as requested, and in year 3, there was no more funding, what would happen to the program?
So that's why I mentioned previously a couple times is what we're looking to do is to be able to obtain reimbursement for some of these services. So for example, medical nutritional therapy is reimbursable by Medicare, Medicare fee-for-service, Medicare Advantage, commercial insurance plans, Medicaid, so on and so forth. And if we can then work with this population to obtain reimbursement for someone who has an insurance payer source, and then we can put that money back into the program. Same thing for diabetes self-managed education, diabetes prevention, and then hopefully when it comes to year 3, we can make this program self-sustaining, because to me, that's what the future requires. If we're going to be able to change the health and well-being of the population we're serving, at the same time of lowering that cost curve, we can't do this on the backs of grants forever. It has to be self-sustaining. That's the way that we would look to do that.
Thank you.
Okay, thank you. With that, I've been given the signal that we're at 5 minutes for your presentation, 5 minutes for your Q&A. Thank you very much for coming in front of us. Thank you.
Thank you.
Thank you.
All right, our next presentation, we're a little bit ahead of schedule, which we're going to knock on wood or formica, whichever's presentable in front of me. At this time, I'd like to call, if they're prepared, Orion Ridge Wellness Clinic Incorporated for their Destiny and Beyond Transitional Program to come in front of the board. Please know you have 5 minutes for your presentation and 5 minutes for question and answers. Please make sure that you state your name for the record, and welcome.
Well, good day. My name is Bruce Eddings. I'm the administrator for Horizon Ridge Wellness Clinic. We are a behavioral health agency providing mental health and substance abuse services to children and adults. We are certified as a provider for Department of Family Services as well as juvenile justice. We are also a provider under Ryan White Part A. We provide mental health, substance abuse, medical case management, as well as supportive services under Ryan White. We are a 330B provider, which is a drug discount program for individuals who are HIV positive. That program allows us to contract with that pharmacy locally and nationally, depending on where we decide to contract with, and to provide medications for individuals who are living with AIDS. Our program has been expanding. We are a grassroots agency here in Las Vegas. One of the challenges that we have seen with our population is most of our individuals who are living with HIV, they either are homeless or on the verge of being homeless. And one of the things that I have wanted to address with developing a wraparound service is to be able to not only provide some levels of housing for them to support housing, but to also help our clients in self-sufficiency and to be able to sustain housing along with the other conditions that they might have. Many of our clients are suffering from mental health and substance abuse. We do address those issues, but we can't address those issues when we have so many of our clients who are homeless and are living from place to place as well. So one of my challenges that we have been addressing for the last 4 years as a Ryan White Part A provider is to be able to provide housing. We also do a lot of things in the community. Our targeted population has been communities of color. We've been doing a lot of advocacy as well as outreach in our communities as well, because if you are aware that African Americans only make up 11% of the population here in Las Vegas and Clark County, and we make up over 33% of individuals living with HIV and AIDS. And so we have been doing a lot of outreach in our community to empower people to be able to take control of not only their health care, but also to be able to make better choices with how they move about their lives. We are about to have our 5th annual Las Vegas National HIV and AIDS Awareness Day this coming weekend, and the event is called, the theme of it is, I Am Here, A New Awakening. It's to help to re-energize our community, to take control, and to recognize that we have a voice in the community. And to also, we'll have testing, we'll have food, we have entertainment this weekend, and we're invited, we have a kids corner as well for our kids as well, for them to have a movie and some food as well, and we're having raffles for our kids as well. So we are really involved in the community to try to make a difference here in the community. We've been doing it, I've been doing this for 30 some odd years, and with that experience, I have licensed social workers, MFTs, marriage and parent counselors, very trained case managers that go out in the community and in some of the areas that a lot of people are afraid to go into those communities to help the populations that are really in great need.
Thank you, perfect timing. Fantastic. This is Chair Miller. I have a question, and then I'll open up to any board members that has it. This is being your first presentation in front of our board. What, and as I'm reading through your application, I know you're affiliated or partnering with Idea Broadband, is that correct?
That is correct.
Okay, so my question is I know I've been on this board for a while, as you go through the process and you're addressing the needs of communities that haven't had that opportunity to get those appropriate services, what are your plans for other memorandums of understanding and partnerships, because this pie keeps getting smaller and smaller every year, and how can we get the most return on investment, I guess is really what my question is.
Well, we have partnered, we have a memorandum of understanding with the health district as well as access to health care. Many of the people that are in this room as well is part of a collaboration of agencies that we work with. We work with AVAN, we work with Golden Rainbow, and some of the other ones that are also here as well. We also work with the Nevada Faith and Health Coalition as well. We work with a multitude of the churches here in Las Vegas, as well as with the Urban League and NAACP as well.
Thank you. Is there any member, the chair recognizes Member Marlin?
Thank you very much for being here and helping this population. I'm Dave Marlin, a licensed alcohol and drug counselor supervisor, and I'm curious what interventions, you said your primary issue is addressing substance abuse in your populations. How do you do that?
Well, actually, the primary, because we have a lot of our clients who have co-concurrent issues with mental health and substance abuse. We have licensed drug and alcohol counselors as well to address the substance abuse issue, but a lot of the issues cannot be addressed when we're talking about so many people that are living from place to place And unfortunately, a lot of times we make a lot of headway with the clients with helping them either reduce the amount of substances that they do use or get them to a point where they're able to become employable. And actually, we do go out and find them jobs as well, because we work with a lot of the casinos here as well in terms of trying to help get a lot of our clients jobs as well. But the drug issue is a challenge for us.
Thanks.
Okay, Chair. The chair recognizes Member Sales.
Hi, thank you so much for being here. And I know about your event that's happening Saturday, so thank you so much. My church is going to be heavily involved.
Thank you.
My question to you is about your wraparound services. My focus was definitely on the grant application of the program that you want to receive funding for. So you say employment, readiness, mental health. When my board member was asking about the other partnerships, who are your partnerships with with your wraparound services?
Wraparound services, well, again, like the Health District, Southern Nevada Health District, NAACP, 100 Black Men, 100 Black Women.
Employment-wise?
I'm sorry?
Employment-wise?
Oh, I'm sorry. Employment-wise, we work with Caesars, we work with MGM.
Okay.
We also work with Southern of Nevada as well. We've gotten people employed there. And we work with a lot of independent employers as well in the community. We work with Mario's in the neighborhood. We work with CVS as well. Some of our local grassroots agencies and our organizations and agents in the community as well that we work with.
Okay, thank you. And then as a board member, I just want to say I saw a flyer. Thank you.
Okay. Chair recognizes Member Janison, and I think then that'll round out our time for Q&A.
Thank you for the extension, Member Janison. Thank you, sir, for your time. A couple questions. First of all, you answered on the one about your board members, are they related or not? And you said that they are related, but you don't address who they are. So can you tell me on your board who's related and how, please?
Robert Edens, that's my older brother, and Vivian Farlow is his wife.
Okay, and they live in town as well?
Correct.
Okay.
Yes.
And then if you could go to question number 25 in regards to the data for the past 3 years, and for my fellow board members, you can see this is an area of importance for me. But your question, your answers really didn't give the 3 years of data. There's a lot of information within that answer, but I'm curious because the only thing that I can see on here is in the past 3 years, Horizon Ridge has served over 300 clients per year. But I mean, how do you track your data? And I mean, is it how many a year? How do you know that they're being successful? So could you give a little bit more background on the past 3 years and how you are really checking to see that you are successful with the dollars provided?
Well, we use two systems. You have heard of CareWare. Part A, we use that system as far as tracking clients in terms of services that they're being provided, as well as we get a lot of our referrals through that system as well. We also have electronic medical records, which is ICAN notes that we use, and we track our clients in terms of the services that we are providing them, the appointments that they do receive. All of our data is put into CareWare as ICAN notes, excuse me, as well, in terms of their progress with treatment and whether or not they're engaging in that treatment as well. And that's one of the systems that we've been using, as well as CareWare.
Member Janison, just another quick follow-up. So can you, when you've given a description of the job descriptions on, sure what question it is, about why it is that you are able to complete this work. So I see job descriptions, but how many employees do you have, and what is it that makes you all, to my partner's question earlier about there's a lot of people doing this work, and what makes you all the best one to be able to be successful to help the clients that are in the community that you're serving, please?
Well, I can say that we really go beyond what is required to do our jobs. Like I said, we go out of our way to try to find housing for our clients, even when there's no housing dollars available in all the programs that we work with. We also find jobs. That's not something that we necessarily, as part of our agenda or our program, to find jobs for clients and resume writing and so forth that's required. And even with identifying a lot of clients who are illiterate that needs that extra help and tutoring as well. We go beyond that. And we also work with children as well. And we work with the entire family. We take a very holistic approach to treatment. We believe in treating the body, mind, and spirit. So we have Dr. Dickens, who's an OBGYN, part of our staff, who also helps with women's issues. We're currently in negotiation of expanding our services. We just was approved as a type 20 to be able to do triage services. But a lot of our clients come in and they have difficulty even getting physicals and stuff, and we want to be able to start providing more wraparound services, and as well as to be able to address some of those other issues like credit repair, like those things that will help them in terms of getting to a place where they're not coming out of pocket to just live.
Thank you so much. We are out of time, but thank you for coming forward at this time. According to our agenda, we are scheduled for a 15-minute break. Then we'll begin and move on to agenda item number 9. So if everyone can be back here by 2:45, I believe we can be adjourned. That's 10 minutes, right? So that's be 2:41, okay? 10 minutes. Go ahead and take a break, and we will come back and move on to agenda item number 9. Thank you.
You made me go over a whole minute. No, I didn't. Oh, yeah. I'm gonna get everybody's name, I'm making notes. Boy, you fast. I hear your little fingers over there, girl. You're tearing it out. On the business. Not mad at her.
Wait a minute, the one that's training. Yeah. Yeah. I thought she was wonderful.
Okay, we are returning back promptly at 2:41. Thank you, members, for watching the clock. At this time, we will move on to agenda item number 9 of our agenda for the Community Development Recommending Board. This is Chair Carmela Shawn Miller. Item 9, discussion regarding allotment of funding for fiscal year 2020, 2021, and 2021-2022 Community Development Block Grant CDBG funding for Help of Southern Nevada, Boys Town, Nevada Incorporated, Catholic Charities of Southern Nevada, Clark County Public Education Foundation, Foster Kinship, Grant a Gift Autism Foundation, Helping Hands of Vegas Valley, Jewish Family Service Agency, Lutheran Social Services, Nevada Partnership for Homeless Youth, St. Jude's Ranch for Children, Homeless Youth Families, St. Jude's Ranch for Children, Therapeutic Residential Foster Care, Tech Impact, and the Salvation Army. At this time, this is a Q&A session, so I will ask you to come forward if there are questions by members of the board. According to our schedule, the group that if you have questions for board members, Helps of Southern Nevada, are there any questions that you have? I see that we have one member that has a question. So at this time, I'd like the Help of Southern Nevada, ERS Rapid Rehousing, to step forward. Thank you. Please make sure you identify yourself as you're speaking, and the chair recognizes Member Harper.
Thank you, Madam Chair. Thank you very much for being here today. Just have a question about the spend, showing that through October of 2019, only 33% of the funds allocated have been spent. Could you speak to that, please?
Hi, I'm Philala Riley, the CEO of Help Us Southern Nevada. With regards to the spend rate, we knew this question would come up. We are usually very adept at spending people's money, but this time around, we took our eye off the ball a little bit, and we had to restructure that department, management-wise. With the new reduced rate or amount, we are on track to spend out everything that's left for us, and I believe it was $11 over.
1975 over.
Thank you very much. Thank you, Madam Chair.
You're welcome, Member Harper. Are there any other questions by members of the board for Help of Southern Nevada? Seeing none, thank you very much. Next on our agenda for CDBG, this is Chair Miller, is if there are any questions, members, for Boys Town of Nevada Incorporated, Boys Town Nevada Care Coordination Service Plus. I see there is a question, so at this time from board member, I'd like to invite Boys Town Nevada Incorporated, if they're present, to come down. Please make sure that you state your name for the record. Thank you. And the chair recognizes Member Harper.
Hi, Member Harper for the record. Thank you for coming. Thank you for being available to answer some questions. Again, this has to do with the spend. We're showing that in the last 2 fiscal years, there was about a little bit more than $18,000 that was unspent and forfeited. Also, during fiscal year 2019-2020, we're at 28% of that award being spent. 2017-2018 fiscal year, $4,000 was unspent. Fiscal year 2018-2019, $14,000 or so unspent. Could you please help us understand why you're not able to spend the amount that's been funded?
Thank you, Member Harper. I do appreciate it. For the record, John Etzel, Executive Director, Boys Town, Nevada. Your number of 28% for the 2019-2020 spend, the most recent number that I have as of January 28th was 39%. So I'm not sure if that if there was an incorrect number somewhere.
It was through October. So,
through October, okay.
Yeah.
Yep. So we're at 39% as of now, and I know 12 months ago at this point in time, we were in the low 20s, and when we had presented at that point, we were having some difficulty with some of the requirements of the grant and determining eligibility for the families that we were serving. So we were attempting to open and work with a lot of families to find out that some of the families were not eligible. I've got our program director here, Graciela Rivera, who may be able to assist with this question also.
Yes, so unfortunately, with some of the families, we spend a lot of time screening, meeting them up in the community, and sometimes they don't go through to actually start services and do the actual program. It's been a little bit difficult with making sure that they are abiding by the city limits, of where they're located, and then other barriers where they might not be consistent, so we really need to explore the commitment and that they're able to complete the 6-month program. And so that time is being spent, and then unfortunately, we weren't able to open some of those families and actually bill for those families.
Thank you. Thank you, Madam Chair.
Thank you, Member Harper. Are there any other questions for Boys Town, Nevada Incorporated? Okay, seeing none, thank you very much. We appreciate it. Okay, next on our agenda is Catholic Charities of Southern Nevada, their Meals on Wheels programming. Do any members have any questions for Catholic Charities of Southern Nevada? Seeing none, we'll continue to move forward. Next is the Clark County Public Education Foundation, their Family Learning Program. Or any members have any questions for the Clark County Public Education Foundation and Family Learning Program? Chair recognizes Member Harper at this time with the Clark County Public Education Foundation Family Learning Program. Come down. Again, welcome. Please make sure you state your name for the record. And Member Harper has a question for you. Thank you.
Thank you. Dr. Beverly Mathis, Vice President of Teacher Exchange and Family Learning.
Member Harper, for the record, thank you so much for coming. Again, this is a spend question. Our data is showing that through October of 2019, you are 41% of funds spent. Can you give us some insight as to why you are behind the pace in spending the funds allocated?
Yes.
Hello, this is Cindy. I'm the Associate Director of the Family Learning Program. So with our program, we also have a partner that works with us, Anson. It's a financial literacy program. So they bill separately quarterly, and I think that's what you're missing. But they will bill on time. It's just that we don't pay up front. We do bill, they bill quarterly.
Okay, so I should have the impression that the services have been provided, but you are able to show that money has been spent because you're waiting for essentially this paperwork and their protocols.
That's correct. They invoice us because they do the program throughout the year as well, so we don't pay up front. So we have a contract where they bill us quarterly, so that's why you're missing that piece.
Okay.
But it will be spent.
Thank you very much.
You're welcome.
Thank you, Madam Chair.
You're welcome, Member Harper. Are there another question? I see Member Walsh. Go ahead. You have the floor.
Yes, hello, my name is Member Bruno Walsh. On question 20, you talk about the Clark County free and reduced lunch program. Are there any steps that you're taking to help eliminate the waste because of the time constraints that the children aren't allowed to eat the food?
Our program doesn't deal with the free and reduced lunch. It's
mentioned in question 20.
Can you repeat that question?
Okay. Okay, are you doing anything to, taking any steps to eliminate the waste in the Clark County School District free lunch program? Because one of the main reasons is the children aren't allowed enough time to eat the food.
Beverly Mathis, we are in all 100% Title I free reduced schools.
Yes.
We do not monitor the food intake nor out. We are just housed there to work with parents.
But it's not something that you're aware of?
It's not something that we are aware of.
Okay. All right, thank you.
All right, are there any other board members? I see the chair recognizes Member Haddad.
Hi, Member Haddad. Just a quick question. So same in question 20, where you lay out the schools, those are schools that you're currently working with and plan to continue the program in, or how are you defining eligibility for what schools you'll be bringing the program into?
Beverly Mathis. We absolutely are. Those are schools that we're in presently, and those are schools, they're city schools, that we're hoping to stay in, depending on what your thoughts are about our program.
Chair recognizes Member Janison.
Thank you, Member Janison. So just to follow up on that, did I hear you correctly, that if you don't receive this funding, you will be out of those schools?
Absolutely. Beverly Mathis, absolutely. Well, yes. We had to cut our schools that we were in, and yes, we are depending fully upon your support.
Follow-up question, if I may, Member Janison. So I didn't have any questions for you all, so you just opened up the door for me. So, because that program, I think, is really good, and I think it does amazing thing for the families, but is this the only way that you do fundraising for this program, is through this?
Oh, no. Beverly Mathis again, no. You're not our only source, but you're one of our biggest sources.
Thank you.
Resources. Thank you.
Thank you. Are there any other board members, Chair Miller, that have questions? Seeing that there is none, thank you very much, Dr. Mathis, for coming with your colleagues, and thank you very much.
Thank you.
All right, moving forward, the next Q&A session we have is for Foster Kinship Navigator Program. Members, does anyone have any questions for this organization? Seeing that I do have member questions at this time, I will ask Foster Kinship to come down. Please make sure, in part of your Kinship Navigator program, that you state your name for the record, and the chair recognizes Member Harper.
Hi, good afternoon. Ali Caliendo, Executive Director.
Hi, Member Harper, for the record. First of all, I think that what your organization is doing with this kinship, I think is fantastic.
Thank you.
I do have a question about the spend.
Sure.
Through October, we're showing that 43% of the funding that was allocated has been spent. Could you give us some insight as to why?
So my understanding is that we have from July through June to spend. So am I misunderstanding the question as far as am I over or underspending in your question?
Well, so yeah, there's a pace of spending that we look to see to make sure that you're going to be on track to have all the funds essentially distributed to the intended recipients.
Yes.
And what we're showing is that you are behind the pace, that you should have been further along in your spend if you were on pace to spend evenly per month. I just wanted some insight into that. Do you see the same thing?
So my understanding, so we've billed through December, which is 6 months, and we're over 50% in terms of the spend, and so we're absolutely on track to get it spent. If not prior to June, we will have it spent.
Okay.
Yeah.
Thank you so much.
Thank you.
Madam Chair.
Are there any other members, Chair Miller, that have questions for Foster Kinship? Okay. Seeing none, thank you very much.
Thank you.
Appreciate you. All righty. At this time, on the question and answered session, we have Grant a Gift Autism Foundation Autism Workshop and Development Project Teen Works. Do any members have questions for Grant a Gift Autism Foundation? Seeing none, we'll move forward. Next, we have for Q&A session, Helping Hands of Vegas Valley, Howe Bus Transportation, or HAHOW, I hope I said that right. HAHOW. Does any board members have any questions? Okay, we have some questions, but I'm going to give you a moment, but I will ask Helping Hands of Vegas Valley if you can come on down and prepare yourself. Again, make sure that you please state your name for the record, and I believe some members have questions for you. Thank you.
Madam Chair, quick clarification. They've got 2 applications. Are they both right now, or which one are we reviewing?
I believe it's just a bus transportation of the agenda that I'm looking at right now.
Correct. Angela Washington for the record. HHOVV Bus Transportation is the program that we're reviewing at this time.
Okay.
Good afternoon. My name is Marcia Blake. I'm the Executive Director of Helping Hands of Vegas Valley.
Chair recognizes Member Janison.
Great, thank you very much. Thank you for being here. It's a random question, but same thing on the question about your board members.
Okay.
And if there is anyone related, you answered yes, and then I looked on it, and so you've got a married couple that's in Florida. So I'm just curious what their roles and responsibilities are, and that was just interesting to me, so I just would like a clarification, please.
That's okay. So on January 1st, 2019, a year ago, Helping Hands of Vegas Valley and Helping Hands of North Las Vegas merged their agencies. And Helping Hands of North Las Vegas had 2 board members that had been on the board for 10-plus years who had moved to Florida. Joe Dabrowski, who was our past president, is currently the past president on the HHOVV board, and he is our IT specialist. So he does all of our database work. He created our database, updates our database, and works on our database. And so for directors and officers' insurance purposes, it made sense to leave him on the board, and his wife wanted to stay on the board since he was staying on the board. So they actually Skype in for all of our board meetings, for all of our committee meetings, and participate that way. And then they travel here 2 to 3 times a year. And when they're in town, they come into the office, work on those things, and then participate in other events that way.
Follow-up question from Member Janison, but I also saw on there that another one of your board members is their daughter.
So Joe and Andrea are the married couple, and Noreen Rysich is actually Andrea's mother.
It's her mother.
She's her mother. And so she joined the board of the North Las Vegas board probably 9 years ago, and serves on our board and on our finance committee, and she still lives here in Las Vegas.
Thank you very much.
You're welcome.
The chair recognizes Member Harper.
Thank you, Madam Chair. Member Harper, for the record, I have spin questions. So our notes are saying that there was $14,000 or so that was unspent and forfeited in the last 2 fiscal years, as well as in fiscal years 2018 and 2019, of the 200 recipients that were targeted, only 167 actually received services. Could you speak to both those issues, please?
Sure. So the money that was forfeited, I can't speak to prior to 18. I'm not familiar with that, as I only became the executive director last August. The funds that were forfeited last year were really due to the merge. As we tried to take over, I was the previous director of Helping Hands of North Las Vegas. As I took over, came in, tried to figure out what was going on, how things were working. We had to reissue some breakdowns. The original grant had been written to provide 1 driver. But we realized that with the way our programming works, it doesn't work that way. We don't have 1 designated CDBG bus. And so we had to figure out what percentage of our clients were actually CDBG and then kind of redo the budget. And that took some time just from an implementation standpoint. And so for that last fiscal year, that is the reason that we did end up forfeiting those funds, was we just couldn't get things up and running in enough time. But on this fiscal year, we are definitely on track to spend all of the money, and we'll most likely have it spent before June.
Thank you.
You're
Thank you, Madam
welcome.
Chair.
Chair recognizes Member Sales.
Hi, how are you?
I'm good.
Good. I just have one quick question. As I was reading through your questionnaires, I noticed that, and thank you for breaking down all the percentages that you have, but is this grant your only way of providing funding or finding funding, or do you do anything else for your organization?
No, so we receive $255,000 in funds from the RTC, and we receive about $313,000 in funds from Aging and Disability Services Division.
Thank you so much.
You're welcome.
Are there any further questions? This is Chairman Miller of board members of Helping Hands of Vegas Valley. Seeing none, thank you so much for answering our questions. We appreciate it.
Thank you. You guys have a great afternoon.
You too. All right, next up, a according to our agenda for Q&A, is Jewish Family Service Agency Senior Lifeline Case Management. Are there any members that have questions for this organization? Giving you a minute. Okay, seeing none, we'll move forward. Next on our agenda is Lutheran Social Services with their Senior Supportive Services. Are there any board members that have questions as we go through this Q&A question regarding the allocation for funding? Okay, we do have one, so at this time, I would like to invite Lutheran Social Services Senior Supportive Services to the microphone if they're present, because I think we're a little bit ahead of schedule, just a little. Okay, city, question for city, can we table and move back, or when they come, because we are a little ahead of schedule?
Madam Chair, Angela Washington for the record, yes, if you would just tack them on to the end, give them a few minutes to get here, but if it is okay with you and the other board members, I suggest that we move on to the next.
Okay. All righty, if we're all in agreement, we'll move forward. The next group will table Lutheran Social Services Senior Supportive Services to give them an opportunity if there are questions, but we're going to move on to Nevada Partnership for Homeless Youth, their Safe Place Youth Outreach and Intervention.
Excuse me, Madam Chair?
Yes, ma'am.
I think we may have someone here from Lutheran Social Services.
Okay. Does any board members have questions for Lutheran Social Services for their Senior Supportive Services? The chair recognizes Member Harper. Please come down and please make sure that you state your name for the record. Thank you very much.
Hello, Marissa Cervantes, Lutheran Social Services of Nevada.
Hello, Member Harper, for the record. Thank you very much for being here. Thank you, Madam Chair. I have a question about spend. As of October 2019, we're showing that 21% of the award has been spent. And for fiscal years 2018, 2019, of the total goal of serving 75 clients, only 75% of those intended recipients have been served. Could you speak to both of those, please?
So as of today, we have 58 participants registered for the program. So we feel that by the end of this quarter, we should fulfill the project outcome goals for the number of individuals.
Okay.
Regarding the spending, we did have a delay in especially in salary. We hired an assistant for the Heart of the Senior Meal Program who resigned a week after. So then we had to take the time to post and rehire again. And so that put us behind on expenses under personnel. But we feel that we will make sure that we are back on track for the second half of the year.
Thank you very much. Thank you, Madam Chair.
You're welcome, Member Harper. Does anyone else have any questions in reference to Lutheran Social Services Senior Supportive Services Program? The chair recognizes Member Sales.
Yes, could you tell me one more time, because I know you were allocated to serve 100 seniors. How many do you have right now?
We
as of
allocated to
February?
serve 75, and we have 58 as of today. So those numbers may have not been reported in the December report because there were new clients that were enrolled in January.
Okay, yeah, no, I see question 22. You did stay 75. Thank you so much.
No problem.
Okay, are there any further questions from members of the board for Lutheran Social Services? Okay, seeing none, thank you so much for coming.
Thank you for your time.
You're welcome. All righty. So next up on our agenda is Nevada Partnership for Homeless Youth, Safe Place Youth Outreach and Intervention Program. Do any members of the board have questions for this organization? I see a nod, so at this time I'd like to invite down Nevada Partnership for Homeless Youth for their Safe Place Youth Outreach and Intervention Program. If you'd come to the mic, please make sure you state your name for the record, and the chair recognizes Member Harper.
Hi, Member Harper, for the record. Thank you, Madam Chair. It's a spin question. I'm wondering about your spend through October of 2019. We show that 18% of the award has been spent, and of the total number of clients that you were looking to serve, total number of recipients of 55, we are at 49. Could you please give us some insight into this?
Absolutely. My name is Arash Kafori with Nevada Partnership for Homeless Youth, and this is...
Melissa Jacobowitz with Nevada Partnership for Homeless Youth.
And let's answer the client one first and then the finance one.
So in terms of the question regarding the clients served so far in the year, so halfway through the year, through the end of December, we had served 27 clients, and our goal for the year is to serve 55 clients through City of Las Vegas funds. So that's just about halfway. 50% of the clients for the year would be 27.5 clients. So we have served 27 clients. So we do feel that we are on track to meet our goal of serving 55 City of Las Vegas clients by the end of the year, and do intend to do so.
And in regards to the finance question, great question. We had turnover with our outreach position, which is principally also in charge of coordinating some of the components of this grant as well. But we rehired for that position, so we look for the opportunity to be playing a little bit of catch-up because there's a little bit of a down period while we're rehiring for that position. However, we are confident that we're not going to have any problems making our goals or spending those down, as historically we've always spent those down. So there's just a little variability related to that, but that should be smoothed over as we have hired that position.
Thank you very much. Thank you, Madam Chair.
You're welcome, Member Harper. Does anyone else have any questions for Nevada Partnership for Homeless Youth and their programming? Seeing none, thank you very much for your time.
Thank you, board members, for your consideration.
All righty. We have two, we're going to do with one. Next on our Q&A session is St. Jude's Ranch for Children, their Homeless Youth Families Program. Any members of the board have questions for St. Jude's and this particular program? I'll give you a second. I see people are looking and scanning. This is just for the program Homeless Youth Families, specifically. Okay, with that, I'll invite St. Jude's Ranch for Children to address questions for their program of homeless youth and families. If you can come on down, please make sure that you state your name for the record. We have board members that have questions for you. Thank you very much. And the chair will recognize Member Janison, and then we'll follow with the rest of the members. Thank you very much.
Good afternoon. Thank you for being here, Member Janison. So my question is in regards to question number 25 on your application, and it refers to the 3 years of data requested. So there's a lot of information in there, and it's obviously a lot of great work, but to me this isn't data. So can you talk about the numbers of children and families that you have been helping, and how you track that as opposed to just within a narrative?
Hi, good afternoon. My name is Denise Charles. I'm the program director for our Housing and Support Services. In regards to question 25, for fiscal year 18-19, we served 212 individuals in our Housing and Support Services, so that includes all of our transitional, rapid rehousing, and family support. Currently, as of today, we have 16 individuals enrolled in the program under City of Las Vegas participants. All of our data goes inside of HMIS.
Thank you, Member Janison. Follow up. And I appreciate that, but I'm just really curious as why wouldn't that have been your answer in your application? Because if it asked for the data, and I'm just really, really curious, because to me that's a very simple answer, and you had it. I'm just curious why that wasn't part of your answer in the application.
Sure. Jed Blake, director over at St. Jude's Ranch for Children. I was responsible for writing the application, so I will answer honestly no, and I appreciate you for asking. For myself, it was come to me more in narrative form because the program has had a couple milestones in the past that I wanted to kind of boast on more than just numbers. And so that was just my interpretation of the answer.
Any other board members have questions for St. Jude's Ranch for Children, Homeless Youth Families Program? Okay, seeing none, the next is St. Jude's Ranch for Children Therapeutic Residential Foster Care. Are there any members of the board that have questions for St. Jude, since they've been kind enough to stay in place? And you have any questions for them? I'll give you a second. I see them scrolling.
The same question.
Oh, the Jeff, okay. The chair recognizes Member Janison.
No, my apologies, Member Janice, it was the same question I had because it was the same thing about the data in there. But in that regard, as long as you've called on me, so what you say is that how you are tracking is through HMIS, and that's how you are coming up with the number of children that you're helping and the outcomes that that you're helping them with?
Jed Blake, St. Jude's again. Actually, for this program, because it's a foster care program, St. Jude's is responsible for utilizing some sort of data management program. We've chosen to use the KaleidCare program, which is a nationally it's a web-based online portal is what the correct terminology, I believe, would be. We pay an annual service fee for that, and we put all of our clients or children we serve, their information goes into KaleidCare, into their own file. That would be the performance related to their goals, their therapy, medication-related information, pretty much an electronic case file that's secure and updated by administrators, house parents, as well as our therapists that we have on staff.
Thank you.
Yeah.
Okay, any further board members have questions for St. Jude's Ranch for Children Therapeutic Residential Foster Care? Seeing none, thank you so much for coming. We appreciate you, and thank you for your time.
Thank you.
You're welcome. Thank you.
All righty. Next, as we move towards a conclusion of our Q&A session presentation, which is agenda item 9, is the agency's name is Tech Impact, and this is their CX Works Las Vegas Customer Service Contact Center Training Program. Do I see people reaching? So at this time, I will invite Tech Impact to come on down and answer any questions. Please make sure you state your name for the record, and I will go ahead and get you all ready for Member Janison, and then any other board member, please just hit your mic so I can know that you have questions. Thank you so much. Again, please state your name for the record.
Do you want me first? Go ahead. Okay. My name is Kara Dorsey. I'm the programs manager for Tech Impact.
Hi, I'm Danielle Maneo, and I am the development coordinator here in Nevada for Tech Impact.
Chair recognizes Member Janison.
Thank you very much. I appreciate your time. So I have a couple of questions specifically around consulting fees and salaries for the individuals. So I know that you guys have got, you're headquartered at someplace else, and the amount of money that you're asking for, it's not a lot, but my question is, you ask for, you say that there's over $3 million that you take in fees, and you're asking for like $35,000 for here. I'm trying to understand what fees are charged, and then what truly is the impact that $35,000 is going to have when you guys have got, I mean, millions and millions of dollars in your organization. So how does it correlate to the impact that this money is going to make for your organization? And are those, the salaries that you're asking for, are those for people living in Las Vegas, please?
Yes, that is an excellent question. Again, this is Danielle Maneo. And to answer your question, our full budget is, I believe, upwards of $8 million. And approximately 70% of our budget is for our IT services and support. And that is run, we assist about 250 nonprofits around the U.S., and that is a break even. So we do not make money on those services, we just break even. 30% of our budget is allocated to our program, our workforce development programs. And the actual money that we have requested for the CX Works program, that budget is $411,000 for the upcoming year. And approximately for the 10 students that we have identified as being City of Las Vegas residents, the cost of those 10 students would be approximately $114,000. So the impact of that money would make a big difference because we are completely philanthropically supported with our workforce development programs. And in answer to your salaries, all of the salaries are for here, for Las Vegas, for the staff that's located here, and they all assist directly with the City of Las Vegas residents. Thank you.
The chair recognizes Member O'Rourke. And then Member Hadid.
Hi there. I have a question about the budget. On the line item travel, there is listed $171,404. Can you explain what that is used for?
The travel would be in pertaining, because we are located in 4 different geographies throughout the U.S., Philadelphia, Delaware, Washington, D.C., and here in Las Vegas. And so we do have some of our staff they do fly in to assist us with our program running. Our executive director, our director of development, our national programs director, and several others. So that covers the cost of their travels, the airline. We do try to do everything as efficiently as possible, so we tend to over budget slightly. We're very conservative. Actually, what I should say is that we're very conservative in our budgeting. So, but that would be what the travel line is for.
Second part of that question is how many staff people does that travel money take care of?
The travel money, it typically, so we have an event that happens in April, and we have certain individuals that come out for that. So overall, our executive director and our director of development and our national programs director, they have frequent flights here to Las Vegas, so they come approximately once a quarter. So that would be the one that would be, so 4 times those 3 individuals. And then we have our luncheon in April, and we do have more of the staff from the East Coast, and they do come out to help us with we're all assigned our roles. So our event person lives in the East Coast, and several other of our staff members.
Thank you very much.
Thank you.
Member Hadid, the last question, because we're running out of Q&A time. Thank you.
Thank you. Just a quick question regarding your client eligibility requirements. It states that clients must have their high school diploma or GED or not completed their bachelor's degree, and I was just wondering why that bar is set there.
This is Kara Dorsey again. So that requirement is specifically because we want to focus on young adults who don't have the opportunity to attend a 4-year university. A lot of our workforce development would be things they would get in a 4-year environment. So we really want to focus on students who don't have the means or the immediate plan to go to college. The high school diploma is for basic employability. The places where we place our students usually ask for that.
Thank you very much for your time. It's ran over our Q&A session, but thank you very much. We appreciate you.
Thank you.
Thank you.
All righty, and now we're moving to our last Q&A session. If the board members have any questions for the Salvation Army and their career corner, do any board members have any questions about the Salvation Army and their career corner? I'll give you a moment to finish your scans. All right. With that, thank you very much. That concludes our question and answer item, and now we'll move on to agenda item number 10, which is a presentation regarding application for Community Development Block Grant CDBG funding for fiscal years 2020 to 2021 and 2021 to 2022, submitted by Iron Sharpens Iron Mentoring Incorporated. If you will come forward, please make sure that you state your name for a record, and you have 5 minutes for your presentation, and then there is 5 minutes for question and answers. So is Iron Sharpens Iron Mentoring Incorporated present with us yet? I know we're a little ahead of schedule. So can we table it and go on to citizens, agenda item number 11, question for staff?
Madam Chair, Angela Washington for the record. I would request that we give Iron Sharpens Iron Mentoring Incorporated a few additional minutes to get here. And if you would, it's of course the chair's prerogative, can maybe take a break at this time?
I think I will do that. Thank you very much for that suggestion.
Thank you.
At this time, it's 3:21. I'd like to give all the board members a 10-minute break and come back because we are on schedule, and we like to keep it that way. Thank you. Now we'll move on to agenda item, again, to repeat for the record, agenda item number 10, presentation regarding application for Community Development Block Grant CDBG funding for fiscal years 2020, 2021, and 2021, 2022, submitted by Iron Sharpens Iron Mentoring Incorporated. Are they present? Okay, come on down. We want to recognize you. You have 5 minutes for your presentation and 5 minutes for questions, or are you waiting for other members?
I was waiting for another member. I believe that our appointment was 3:55.
Okay. Staff?
Chair Miller, that is correct. Their appointment is for 3:55 p.m.
And we're ahead of schedule.
Yes, we are.
So can we go on another extended break, staff, in order to give them that opportunity since they are a new application?
Chair Miller, this is Angela Washington for the record. Yes, you may.
Okay. All righty, we're going to go on another break. Okay. We're going to go on another break and wait till they get here so we give them an opportunity to make their presentation. Thank you. It is 3:41. This is Chair Miller. We're going to go back on the record as we conclude our agenda. We're on agenda item number 10, presentation regarding application for Community Development Block Grant CDBG funding for fiscal year 2020-2021 and 2021-2022, submitted by Iron Sharpens Iron Mentoring Incorporated. At this time, I'd like to invite Iron Sharpens Iron Mentoring Incorporated to speak about their mentoring program that they're asking for an allocation of funding. You have 5 minutes for your presentation, and then 5 minutes is open for board members to ask questions. Please make sure that you introduce yourself for the record, and when you speak that you identify yourself. Welcome, and thank you for your time.
Thank you. My name is Camelia Williams.
And I'm Coach Williams. I'm the founder and CEO of Iron Sharpens Iron Mentoring. We are a group mentoring program working with at-risk boys ages 9 to 18 years of age. We've been doing it out here in Las Vegas now for 6 years, and we average 100 boys per year that come into our program. Most of the boys we get come from diversion court or through the harbor, but I get boys from the community, social workers, pastors, anyone who needs to help, we try to help. It is a 12-week program. We meet on Saturdays for 2 hours, and it's an evidence-based program that's also strength-based. I've been mentoring myself personally for almost 40 years, so I do this as a passion, and I love what I do.
Is it my turn?
Your turn.
Okay. Again, my name is Camelia Williams, and I am the volunteer coordinator for the program. And I've been with the program since its inception 6 years ago. And as he said, we do it as a ministry, and we, at this point, we're just providing services for boys, but our future plans is to provide services for girls as well. My background is human development and child development.
And a little about my background. My degree is in economics. I have a bachelor's in economics, but I've been a football coach for 25 years. I coach football at every level, to working with the little kids, to high school varsity coach, to working with the 49ers in their youth program. I've been doing this for a long time, and I do it primarily because when I was young, a coach did it for me. He was the one that could reach me when my parents couldn't reach me, when my pastor couldn't reach me, the coach to reach me. And I used that to try to reach some of these young men that I work with.
Thank you very much. Are there board members that have any questions? I see some nodding. The chair recognizes Member Harper.
Hello, Member Harper, for the record. First of all, thank you very much for coming. And I can identify with the value of what you're bringing and the value of the program. I'm trying to reconcile what our board is charged to do and how we evaluate our programs with what you are presenting to us. So it's like, intuitively, I see the connection. But when I went through your application, it was difficult for me to marry it as precisely as I would like. So specific questions would be, on number 18, the goals and outcomes of the program. Let's make it a little bit more bottom line and brass tacks. If we fund, we need to be able to show discrete, measurable outcomes. So what discrete, measurable outcomes can we essentially say back to the federal government were achieved by providing this funding?
What we're doing currently is we're working with about 100 boys, mostly through diversion court in the harbor. But there are hundreds of boys that reach out to us that want services, and they cannot afford them. With the funds that we got, we plan on doing at least 50 more boys, and we also want to do the girls and stuff. But we're working with the boys to make sure that they can get the mentoring services that they can't currently get because they can't afford it.
Thank you. I appreciate where you're going. Let me just drill down a little bit more.
Okay.
So your application was in response to an RFP by the city, and the city has specific measurable results in certain categories in order to be eligible for funding. And as I look at your application, I have to work to get how you've responded to fit the RFP requirements. I'm not trying to figure out how to not support. I'm trying to figure out how to support. But I'm looking at you for additional information that can help in our way of thinking about it. When I look at your application, so the first one we just talked about, which is what goals and outcomes of the program are you looking to achieve? And those weren't clear enough to me so that we can respond to the federal government if they asked us how we allocated the money. Also, the measurable outcomes that you have for the last 3 years, also, I'm not clear as to what those were. I'm clear that you mentored. I'm just trying to figure out how we can measure the benefits of the mentorship. That makes sense?
You can answer that.
Yeah.
Excuse me. So one of our goals is truancy, is to decrease the truancy rate, because a lot of our youth who come to our program are, if they are in school, they're not necessarily going every day or to every class. And another goal is to decrease the drug usage of the kids. Also, we're running into a lot of parent-to-child domestic violence. And so that would be another of our goals, is to try and to decrease or stop that.
And I get that. And part of what would make it easier for this board is for you to say, this is what the truancy numbers are. Our program came in, intervened, and now they've been lowered or affected. This is how, frankly, we're all going to be evaluated. So this is what we're looking for you to essentially pledge and promise, with a baseline first, and then the impact that you say that you're going to provide, and then after you've run a funding course, you can come back and report what you've actually done. Either you hit the mark, exceeded the mark, or short of the mark, but something along this trajectory. What I'm getting from you is that you all are doing great work and that you all are making a difference. What's difficult for me is, how do I measure the great work that you're doing? If this makes sense. So that's why I keep pushing.
I got you.
So it sounds like you're looking for a percentage. So we graduate about 65% of our youth. And those youth so far have not returned back into the system.
I'm sorry, so when you say you graduate, you're talking about the ones that go through your 12-week program, correct?
Correct.
Okay. And so what's involved, Madam Chair, am I?
No, I think it's a clean question. Go ahead.
Okay. So can you be more specific as to what's involved in the 12-week program? What are they doing every week for 2 hours?
For the 12-week program, it is a systematic step-by-step program. The first week, we do an assessment orientation with the youth and their parents, where we get a chance to assess the issues that the parents have with them, to look at whether or not they may need some other services that's beyond our scope, that we can help them with that. After that, we have an agreement that the youth participate in. They come up with an agreement of how they will act in the program so that they could have a buy-in. So that's a week 2. And with that, they have to come up with at least 35 items that they have to do, and one of them is going to school, being respectful, and learning about integrity, which is one of my big programs that I really push. After that, they learn about anger management, alcoholism and drug reduction, how to interact with law enforcement, how to communicate with teachers. We look at tutoring and the subjects that they need the tutoring in. There's a whole 12-week list of things that we cover, one at a time. After week 8, if the group has some specific issues that's beyond what the regular template is, we reserve the right to use those last 4 weeks to help them with those issues. Gang violence, weapons, all those kinds of things that I deal with.
The chair recognizes Member Janison. I want to make sure we have enough time for questions.
Thank you. Member Janison, and I agree with Member Harper. Thank you for that. It sounds like you guys are doing great work and really making an impact for the children that you serve. But I'm going to go a little bit to your budget, if I may. So if I heard you correctly, so currently no one has a salary, so no one's pulling a salary for your organization?
The only person that receives a salary when it's available is me.
Okay.
And that is $1,600 per month.
Okay.
Last year, I did not get paid but 6 months.
Okay.
So, yeah.
So if I pulled up your 2018 990 that you submitted, and in the current year of 2018, it says that you brought in $25,000, and the year prior, you brought in $33,000. So I guess my concern is you're asking for $50,000 for this organization to fund the work that you're doing. What kind of capacity do you have to utilize that money? And when I pull up what you're looking for the budget, it looks like it is all operational and it is salaries, which you deserve a salary, so I'm not trying to say that. But I guess I'm concerned that you're going from 25 to 33 and then asking for this bucket of funding to pay for your whole year. Can you just talk a little bit about how you built out your budget? And for the past 3 or 4 years, it's doubled each year.
Well, where our plan is to hire someone to do the coordinator work, because we're becoming bigger, larger, and it's more than I can handle. And so we're actually looking to hire out. And so that's why the biggest part of our budget would be for that, to hire out a coordinator.
So, Member Janice, if I may just follow up then. So I guess help me understand, or the board understand because you're asking for rent, do you have a building? Other fundraising? So I see some things in here that you say you're going to do, but I guess I'm just a little concerned that where the capacity is to be able to implement the
We're
work.
currently doing all our stuff at First AME Church, where I'm an officer there at the church, so I pay a minimum rent right now, but we've grown to a rate that we need to go out and try to get our own building. Currently, what we can do at our capacity is about 90 boys per Saturday. So that's what we do. We do 3 groups of 15 boys, 10 to 15 boys each in the morning and in the afternoon. So 90 boys is our capacity right now, but when we do this other thing, we'll simply increase the hours for another 2 hours so that we can do another 45 boys.
Thank you so much. I think we're at time right now. We want to thank you very, very much for your time and coming in and encouraging you with your program. Thank you so much.
Thank you.
Thank you.
Welcome.
All right.
All righty, thank you, board members. We're moving on to agenda item number 11, citizen participation. Public comment during this portion of the agenda must be limited to matters within the jurisdiction of the board. No subject may be acted upon by the board unless that subject is on the agenda and is scheduled for action. If you wish to be heard, come forward and give your name for the record. The amount of discussion on any single subject, as well as the amount of time any single speaker is allowed, may be limited. Is there anyone that is like to do citizen participation at this point? Seeing none, I'd like to make a motion can I get a motion for adjournment, if I'm following the agenda properly?
So moved.
So moved. I have a motion by Member Moreland that we are to adjourn. May I have a second?
Yes, Member Sidney seconds it.
Member Sales seconds. It has been moved and seconded that we adjourn at this time. I will call this meeting adjourned. Thank you.